With regards to eyelid rejuvenation, we talk about the upper eyelids, and we've already discussed an upper blepharoplasty or upper eyelid surgery. In the lower eyelid region, there are several other things that occur, and it's a little bit more complex to discuss. There is an analogous procedure called the lower blepharoplasty, and we used to perform this very commonly. Of course, we still perform it, but I'd like to review the indications for it and how it's different from how we used to do things. In the past, if you came in and we were getting ready to perform your upper eyelid surgery, you may have been leaving the office and you might say, "Hey doc, what do you think about my lower eyelids?" And I'd say, "Okay, let's go ahead and we'll treat your lower eyelids as well." Well, we'd come back from that procedure. Of course, we'd have a little bit of a discussion, but following the procedure, you may come back and you'd say, "Look, I still have this line. How come it still looks a little bit dark?" There'd be concerns or complaints that you would still have. Back in the day, we didn't have a lot of other treatments to offer you, and so we would perform surgery. In the lower eyelid, the anatomy is like this. There's a partition, just like the upper eyelid, called the orbital septum, and there's some fatty tissue, there's some fat around in the lower eyelid area that often begins to protrude on that area. Patients will complain of a bag or a circle underneath their eye, and that's representative of this fatty tissue. Surgically, what we can do is we can go in there and shrink or remove some of that tissue, and that's what we used to do. We used to remove all of the fat that we could get our hands on. The problem with that is while we might have removed the bag, we created a new problem. We created a situation where people look cadaveric or sunken in or hollow. And now what we have is we have this big dark area where there's a shadow. And that was commonly what all of us used to do. Over the past decade or so, there's been a big transition away from removing all of that fat and being more conservative with the lower blepharoplasty. I'm going to touch on that in a moment. In addition to removing the fat, sometimes there's some extra skin in this area. And for that, we might remove some of the skin, and we might call it a pinch excision. So a lower eyelid procedure or a lower blepharoplasty deals with the extra fatty tissue and or some of the extra skin. With regards to how we perform a lower blepharoplasty, there are two main approaches. If, in fact, we need to address some of the extra skin, we will perform what we call a subciliary incision. And very simply what that means is we're making a little incision. It's about 1 millimeter away from the eyelash line. It allows us to elevate the skin. We use some Q-tips to get down to the fat where we will remove or shrink some of that fat conservatively. But it also allows us the ability to remove several millimeters of skin. In patients where they only have fat and there's not extra skin to remove, we'll perform what's called a transconjunctival incision. And very simply what that means is we're going to make a little incision on the inside, on the back part of the eyelid, and we retract it and we use some Q-tips and we go right down to the fatty area and we shrink or remove some of that fatty tissue. In that instance, there are no sutures, there are no stitches that are used to close that incision. However, a lower blepharoplasty, while it might address some of the fatty tissue and some of the extra skin, really isn't the only solution. And these days, the solutions I'm about to discuss are probably more common and procedures that do something different than what lower eyelid surgery offers. So there are two non-surgical treatments to help rejuvenate the lower eyelid that we commonly perform. And one is the use of fillers. Everybody has heard of fillers, and fillers are a class of materials that add volume or fill in things. The class of materials that we commonly like to use are called hyaluronic acids, or HAs as we call them. You might know these by the name Restylane, Juvederm Ultra, or now Juvederm Voluma. Hyaluronic acids are naturally occurring products. They're found ubiquitously. They're part of life. They're part of our bone, they're part of skin. Therefore, there's no skin test required, there's no allergy. Hyaluronic acids have some unique properties also. They're soft, they're malleable, we can contour them. They are also reversible. Let's say for some reason somebody doesn't like them, we can dissolve them instantaneously. This isn't something we like to do, nor is it anything that we need to do commonly, but it's nice to know that we can do that. It allows us to go for it. It allows us to fix the problem and not worry so much about using these products. That's not true of many other classes of products. your own fat, Radius, Sculptra, Artefill, and many others. So in our office, we prefer initially to use hyaluronic acids in this area, and they work quite well. The biggest difference between Juvederm Ultra Plus and Juvederm Voluma is its duration. Juvederm has been around for a long time. It's the #1 filler that is used, and it can be used safely in the lower eyelid area. It typically lasts about 9 to 15 months. Last year, Juvederm Voluma was FDA approved after being used in 72 countries for 9 years, finally made its way to the US. Juvederm Voluma lasts 2 years by FDA standards. It also gives a little more of a volume approach, okay? So it allows us not just to contour the lower eyelid area, but we can do some other things in the cheek and throughout the face. We'll talk about that when we discuss Juvederm Voluma a little bit later. So besides the lower blepharoplasty, using fillers, these hyaluronic acid products are a wonderful way to improve the contour, the concavity that we often see in the lower eyelid area. Children typically have more volume in their lower eyelid. As we age, tissues begin to descend, we lose volume. And most adults have a concavity in this area. It's concave. And so what happens is we have the convexity of our cheek and we have the convexity of our fat pockets here. So when light bounces off of it, it casts shadows into this concave region. And therefore the shadowing makes our eyelids appear more tired. And if you look at my eyes, I'm a good example of what you can see there. So using fillers will fill in that concave area and therefore rejuvenate the eyelid. And in this photo you can see before and after, immediately after filler has been placed in the tear trough area or this concave region that we're talking about. There's another unique property of hyaluronic acids, and that is they are hydrophilic. That is, they are water-loving. They attract water molecules. So one of the advantages of having a hyaluronic acid filler injected anywhere is that even if as it begins to slowly resorb over time, it still has this property where it's attracting water molecules, and for those very fine lines that we have, it helps fill those in as well. In addition, many times patients will have a true discoloration in their lower eyelid area. That is, it might be gray or green or yellow, and there's some true discoloration. Fillers aren't going to fix every aspect of the lower eyelid problem. So sometimes treatments using retinols or retin-A's, using vitamin C's, using good skincare regimen will assist. Similarly, we provide a fractionated CO2 laser resurfacing in this area to help with some of the fine lines, the crepiness, the discoloration, and stimulate the production of collagen. So many times when we're talking about lower eyelid rejuvenation, depending upon what the goal is, depending upon how things look, we might choose non-surgical options, fillers, and skin treatments ahead of surgery.